From some of the information I saw was that both surgeries were successful. They wait, 3 or 4 days after the injury to let the swelling go down. And with both Mariota and I think Carr, I know with Mariota, he's non-weight bearing for 6 to 8 weeks, meaning they'll put that leg in a brace or in a cast. He's not allowed to put any weight on it. Mariota, they said he was on a knee walker or a little scooter to kind of prevent from having to put weight on his leg. Carr, I haven't seen that. But anyway, it's going to be 6 to 8 weeks to allow healing to occur. And
Now, what does that mean? So, like, when we say 6 to 8 weeks for healing, I mean, what kind of healing is in 8 weeks? Is he back to 100%, or does that mean he can now start running around again and walking again?
So, great question. 6 to 8 weeks, any tissue in the body, whether it's bone, ligament, tendon, has different healing timelines. It takes a little bit longer depending on the type of tissue. Normally depends on how much blood supply, because blood brings healing. But so it depends on how many ligaments were involved. Generally, for this type of surgery, it takes 6 to 8 weeks for everything to heal back to where he can start putting weight on it and start rehab. I always have to tell my patients when they're coming in after surgery, for the first 4 weeks to 8 weeks sometimes, we're just trying to keep things from getting locked up. We're not trying to increase strength at this point. We're trying to maintain range of motion, preventing things from getting stiff. So he's got 6 to 8 weeks of letting it heal. They may do some things to make sure it doesn't get stiff, being in a boot for 8 weeks. They make sure just some general range of motion, some stretching. But he's got 6 to 8 weeks, both of these guys, of letting it heal, like stretching, and then the rehab process, right? And so some people have asked, will Derek Carr be back for the Super Bowl? To which I say, no way.
They're not getting to the Super Bowl without him in the first place, but carry on.
That is a great point, because even if they got there, let's say something happens and they get there, you're not going to put a guy who hasn't even practiced in 6 to 8 weeks in that time of a game scenario. I think McGloin, he's not that bad to where you have to have somebody who's had a fracture out there. But after the 6 to 8 weeks, then he starts his rehab of strengthening the ankle, working on proprioception, balance-type drills, and that in itself will take a couple months. So both of these guys, for me, for a complete recovery, are looking at 4 to 5 months. It seemed from what I read, it's straightforward surgery and rehab. I think their careers are going to be fine. I think these are two young stars, but they're definitely out for a while. And there's Raider fans, I'm sorry, I don't see any way that he's going to be back in time for the playoffs.